Hi, good afternoon, everybody. Thanks for joining us at this week's weekly Wednesday webinar. We've been bombarded with AI. Everybody wants to talk about it. Everybody wants us to do something about it. Everybody thinks they know something about it or should know something about it, but just not quite how far it goes. So today I thought we would try and get back to basics and think about our students and think about ourselves in relation to our students and who we'd like to be, who we'd like them to be in terms of building their own identity and in terms of developing the adaptability that will be necessary for them to really thrive in the world that they're training to be a part of. So thanks for joining us. And this is supposed to be an interactive session. So I'd very much like it if you could participate as we go through. If things occur to you, please just jump in, open your microphone and tell me, and let's get started. So I think the first thing we might have to think about is, let me see if I can move to the window that I'm looking at, and that is this. If you can open another tab on your browser, and if you can then log on to the site polev.com/Shirra Moch 652, or there's a really cute QR code over here. Let me see if I can, yeah, the QR code's still there while you log in. So while you're logging in, I'm going to ask you, from your experience and from the things that we read about what Wits wants for its students and what this faculty wants for its students, can you tell me or list for me the key desirable characteristics of a Wits healthcare professional? What would we like them to have and to be? And if you're having problems logging on, can you open your mic and tell me, because I need to know if there's something I need to be doing here. Okay, yes. If you want to put words together, you have to hyphenate them. So we want team players. We want people to be employable. Yeah. And for that, we need, thank you. For that, we need there to be the kinds of jobs that we want people to perhaps be working in. Yeah. We'd like them to be able to communicate. You can put in more than one, by the way. We're not such a big crowd that you only have to have one answer. So do we want them to be leaders? Empathic, I guess. Yes, knowledgeable. Personable. Does skilled go with knowledgeable? Are those two different things? Okay, competent I like. I'm not sure where we get with the corrupt one. Was that supposed to be together with something else? As in non-corruptible? Professional. We want them to be competent, knowledgeable, professional. Yeah. And what does that actually mean? I really think that's interesting. I saw it. We want lifelong learners. We want them to be able to practice in an interdisciplinary way. Critical thinkers. Wow, this is lovely. Yeah. I'd say that there are definitely a lot of attributes here that are absolutely important. Resilient, hardworking. All of those things make a huge difference to how our healthcare professionals are and will be perhaps in the future. Sure. Okay. So perhaps now let's go and have a look at how we could actually get there. So those are all things that you think are vitally important. And thank you for your participation. I think it's really interesting to see the kinds of things that we're looking at. But the question has to be, of all of those things, how do we think about intercalating AI into those fantastic attributes that we're looking at for our healthcare professionals? So are we supposed to be training them to use AI as it's going to be in medical practice or in healthcare practice? In other words, in a technical sense? Or are we just wanting them to be able to use it so that they can come into the market with a usable skill, like, for example, knowing how to use Microsoft Word or being good at Excel spreadsheets? Or how are we going to develop those graduate attributes and skills using AI or despite AI? So I'd be interested to know, if you can drop in the chat, how you think we could use AI in developing all of those graduate attributes that we're talking about? Is there any way, just off the top of your head, you could think that we would be able to use it in that way? So, I mean, I'll unpack it and say that I'd say that the risk that we're looking at here is producing really competent technical people. So people who can use the apps that are out there and incorporate it into their daily lives, but at what cost? So are we saying that they're tech compliant, but relationally weak? You know, you go to see the healthcare practitioner who's busy capturing notes on their screen as they're talking to you, and they don't actually make eye contact with you because they're so busy capturing their notes and using tech effectively in their practice. So I think that what we're trying to say is that our education and how we're planning our education should prioritize those things that can't really be captured by AI. Things like interpersonal complexity, things like ability to reflect and then reflect back. So communicate with people in that way, in a reflective way, and show care. I know there's lots of literature coming out now about how people respond better to the AI if the AI responds nicely to them. So if the AI says, yes, that's a good question, and then proceeds to give you an answer, apparently that's a good thing. But to be quite honest, I think that there probably isn't a replacement for interpersonal care, as we're trying to say in terms of those attributes that you pulled up: professionalism and communication and helping patients to feel like we're involved in their lives. So yeah, Michael, I like your comment. And I think, so what you're saying is that the students will be encouraged in their belief that a superficial engagement can, especially with the tech, can demonstrate competence. So what I'm going to try and do today is unpack how it is that we can maybe incorporate, yes, those technical skills, but still work on the humanism of training in the health professions. So people will always show you a slide like this. They'll say the health landscape is changing. Well, to be honest, the health landscape has always changed. Yes, we could use AI more in all those areas where people are giving us fantastic workshops and webinars. And maybe it is easier now to understand those big crunching things that people always had availability of. You know, the idea of big data, but big data now being much more available to us because all you have to do is ask the large language model and it will put everything together so that you can understand it, even at the level of a 5-year-old. So yes, tech improves, but tech improves and always has. I would say that it's not exponential. It's more like of a Stephen Jay Gould. He was an anthropologist but spoke about punctated equilibrium. So you have a huge exponential surge and then you develop a bit of an equilibrium and then another huge surge and then maybe some equilibrium. So I think the cynics amongst us would say that yes, we're in a post-truth world, which is evidence all around us, I think maybe. But people are pushing for the idea of the post-human world, the H+ world, where we only interact through tech in making the world what it is. So in other words, that humans will kind of merge with tech. And I'm not really talking about implants and stuff. I'm talking about our capacity as humans and using tech for that. But I guess, that's kind of maybe another whole debate. So in that landscape, where all of those things are not only taken for granted, but we have to have some sort of technical skill in dealing with how we're currently training our students. How should we be training our students? So the first thing I want to know is we're now in June. So from January to June, where this discussion has been almost constant, has anybody here sitting with us introduced an element of using AI into any of their, let's start with teaching, any of their teaching, so any elements of AI in the teaching that you've currently done from January to June? It's not a challenge, I'm just really interested to know. And if you haven't, then I'm quite happy for you to put in the chat, I haven't done anything. Emmanuel, maybe tell me what it is that you have brought into your classroom, what it is that you're doing with your class using AI.
All right, good afternoon.
Hi.
So this was with respect to when I realized that the students were copying and pasting directly from AI sources for their
Yeah.
assignment. So I had to chip in and say have a whole session as to how they can use it as a guide rather than copying and paste. So we
Yes.
did have a long 2 hour chat, and the students were telling how their clinical rotation and classroom teaching were it was too together, so they couldn't get time to think. So the best way to meet assignment deadline was to just put it in AI and format it nicely and just drop it. So I had to go with them step by step how to use it rather as a guide to assist them with their clinical
Okay.
assignments and some few research stuff. Yeah.
Okay. So you noticed something, you put in an intervention to make their use of it better.
Yes. Yes.
Yeah. Okay, that's exciting. Is there anybody else who's done something like that? Yeah, okay, they are. All right, so in an editing capacity, you're using it for your students to help them with writing and editing. So that's definitely in a tool capacity, right? And I guess there are other ways in terms of the daily teaching that we do that we can help students to definitely incorporate, because there's a perception out there that students are for sure using AI. Now, the question really has to be, what are our students using it for in our specific topics to achieve the outcomes that we've basically still set them? So I think that it would be useful to interrogate how we could use it in our daily practice. And yes, okay, so looking for data, etc. That's interesting. Let's then try and link this teaching that we do and the usage that we think students are doing towards those graduate attributes. So we've always had, who we want the Wits graduate to be. That's part of like the things you'll find on the Wits website or on the marketing material. And in our faculty, of course, we've also got who we want the Wits health professional to be. And they give this range. So here you are. Are these ends of dichotomy, perhaps? Or are they ways of incorporating all of these in the ways that we want our students to be? And this came off one of the endless webinars that are now out there on training healthcare professionals and incorporating AI usage. And to be honest, I don't see the dichotomy in some of these. They're all things that we want our students to know how to do, and maybe to have built those, atomic habits, those habits of being that we want them to have in order to be able to pull out the kinds of responses that are appropriate in the environments that they're in. So looking at how things have always been done, the traditional focus, versus looking at emergent needs. And in our circumstances, certainly the needs are large, especially in Gauteng, if not nationally, and then, of course, globally. Is there a dichotomy between clinical knowledge and critical thinking? And that then leads on to decision making and patient management, etc. Or in the lab as well, making those decisions. Having absolute technical skill versus AI and digital literacy. We have spoken about the implications of what the word literacy would mean for using not only equipment, but prompt engineering in AI. And then this one I liked. They had a big debate on communication versus ethical reasoning. And to be honest, I think that in a lot of our time-bound curricula, we don't have that space to allow students to model the ethical reasoning that they're supposed to graduate with. They're told about ethics, but I think that the opportunity to engage in ethical debate, but also be faced with ethical dilemmas, is something that we could look at more in terms of developing our curricula. But I'm sensing raised eyebrows here in the when and how would you work that in? And then the last two, which I speak mostly to in terms of adaptability and humanity, but still reflecting the professionalism that we actually want our students to have, which was a very big word in the word cloud that we did. So it's apparent that lots of people think that professionalism as a trait is important in our students. So let me unpack then Why I chose the phrase being and becoming. Those versed in some of the education tech would know that that is a phrase that comes from Brenda Leibovitz, who was from UJ. She's no longer with us anymore. But being, as in who is this graduate that we want? So at a personal level, it's for the student to make the decision of what kind of person am I becoming as part of this training? Who do I serve in terms of doing the work that I do every day? And then how do I maintain ethical integrity and empathy in my daily work? So I would say that distilling out a lot of the things that you think are graduate attributes, this concept of the whole being, I mean, these are only some of the questions that I think are important, but who are you? Who do you want to be? So that identity development. I mean, I think the dichotomy here that most people worry about is the idea that if I am to become somebody who is AI competent or tech competent at all, it should be in service of my profession, whatever that profession is. And it shouldn't distance me from the work that I'm supposed to do, the patient care or the work in the laboratory or the interpersonal work with people. And I think that how we can develop this in students is to give them the tools to reflect on why they're doing what they're doing. And then that might give them some sense of balance into how much of the AI that they're engaged with could be influencing who they actually are. I know that some of these devices that we have give you you can ask for a daily, but it can give you a weekly average of the amount of time you spent on certain activities. And I personally realized that there's a lot that I'm going to have to do. When my little device told me, no, you've spent on average 16 hours a day reading your screen. So clearly there are things that I need to be doing that is not academically engaged reading work. And I think that things like that are a wake-up call that our students need to be taught about, because otherwise there's the risk of just getting blown away and carried up with the things that they need to be doing. Okay, so being is one side of it, and being is a personal thing. So it's about helping students to confront that, if you will. Becoming, I think, might be more of a challenge. So all tools change. I mean, if we look at the disruptions that we've had over the last 10 years, perhaps starting with the fees must fall in terms of the disruption to teaching and disruption to maybe emotional withdrawal, and therefore the need to get more engaged and more involved in what are considered appropriate curricula or what are considered ways to manage how students engage with higher education, all the way through to COVID, where people had an element of fear as well as having to do their daily work, especially in hospitals under a lot of tension and pressure, and also pivot their teaching. And now the post-COVID, which I think is really interesting, because a lot of the backlash is, can we go back to the way we were before? Or can we leverage on what we learned? Or who's got energy for any of this? Because look at how much we're still having to do. So the element of how we teach, what we teach, I think leans into this idea of becoming, of the student becoming because of how we're teaching, or because of how we're designing the learning environment now for students to interact with. So I think in terms of becoming, one of the major traits that we're really encountering is this idea of adaptability and resilience. Resilience on the one hand, the ability to bounce back maybe, but adaptability is seeing the patterns and being able to change through what the patterns are showing you. And the element of curiosity. If our students are not curious because they're so bombarded with what the outcomes should or could be, then we're shutting down on this idea of becoming, of this person who will always look for more and pursue the interest, which is the kind of student that I think eventually becomes that thoughtful healthcare practitioner. So it's not just what to learn, really, but but learning how to learn. And that itself is in terms of practice, I think. Let me ask you then, if you're still in that second tab, you can just refresh your screen. And if you refresh it now, or if you closed your tab, can you just log in again to polev / or you can just click on the QR code up in the corner. So, okay, you were letting me grandstand a little bit and talk about the being, in other words, the development of that professional and all those professional traits that we want of the student, or the becoming. How is it that we're going to help students develop the curiosity, develop the resilience, develop the adaptability that it's important for, we think, that whole student who can utilize whatever's in their environment, including AI, but not exclusively. Okay, I'm just taking that away so that I can see. Yeah, that's interesting. I'm waiting to see if anybody else is going to answer first. And you can get all sorts of, catchphrases. So being as thinking of your own identity in a digital age. So do you have an identity apart from your digital prowess, maybe? And then learning as growth, as extending beyond what you know, and thinking of new ways to engage with the world, which I definitely think is something that we don't spend a lot of time with our students doing, because there is so much tension in getting to the end, in doing the exam, in reaching a conclusion over the training, that perhaps this being and becoming would, sorry, I slipped the slides. The being and becoming would be a part of how it is that we think of training our students. So I'm going to stop here and ask you, if we were to say that we were redesigning curricula from the outset and looking at developing learning experiences for students that focused on this idea of caring, building an identity of humanism, of understanding where you stand in the world in relation to everyone else that you're dealing with, be it immediate family, all the way through to the people you interact with at work, or patients, or the wider community, or public health aspects of activism. How would we think about positioning tech use into those humanistic tendencies that we're looking for? Do you think that it's a dichotomy, or do you think it's doable? And I won't push you. I'm not going to put you on the spot, but if you think it's doable, then maybe that's something that we need to work on in the near future. So I'll give you a cheat sheet first. So everybody here knows that these are things that we already have in place, that we've started, but there's lots of space, I think, to utilize these kinds of teaching modalities more. And by simulation, I'm talking about not just in the simulation laboratory with mannequins, with high fidelity simulations. All kinds of simulations are possible. Flat screen simulations where with your class, just with a device, you can simulate lots of activities that allow these kinds of thinking, particularly the ethical dilemmas. And why am I harping on that? Because ultimately, university education is leading towards these citizens of the universe that are going to be involved in not only management, but leadership, and leadership of large areas of influence. So it would be important to give people the opportunity to try out different personas in terms of particularly looking at ethical behavior, critical engagement with AI tools. And so that leads us to, for example, I see public health here. One of their slots in their research day is ethical use of AI in research in the public health context. Well, what is that ethical use? And also, do we have any ways of monitoring that use at all? I know some of us went to the workshop by the Grammarly people, who everybody's scrambling in a marketing sense to say our software can do it. But so far, I've not seen anything that shows clearly where AI has been used, except where I am reading things and think, oh, this was AI generated. So, I mean, Emmanuel, you said you could see clearly that your students were cutting and pasting from an AI generated document. When you're au fait with the subject, it does seem easier to do that. But that kind of advantage of experience will eventually get blunted because students are learning from the AI. So eventually you could get a good student who is producing work that looks like it was written by AI, but it wasn't. So that idea of not policing, but rather encouraging and, yes, developing the professional ethics of saying to what extent AI was used and where it was used is possibly the only way to go at the moment. And I think it's the approach that the Central University is taking, is that you need to get students to be encouraged to use AI in a scaffolded way. And that's why looking at teaching strategies with regard to the idea of critical engagement means that we have to redesign the kinds of things we're asking our students to do. What is the assignment? How could I give feedback at areas along that show how the student has used AI and whether I can critique that use of the AI as well, which means that, yes, it will be a time-bound thing in the curriculum, but we can't rely on giving the kinds of assignments that we did before thoughtlessly, because there are a lot of tools out there that can be used in engaging that kind of thinking. I'm not going to spend a lot of time on the idea of interprofessional education and also coaching and mentoring, because those are two areas that I think require specific energy and effort, and it's something that can't be a sort of sporadic add-on. It's something that has to be deeply embedded in what it is that we do. And at times we have had that, and at times it has lapsed. And so given the idea that these things are useful in the concept of being and becoming, there are things we certainly need to take on board. I just want to know if anybody's had any experience at all with the idea of narrative pedagogies. I know some people have used narrative methods in research, but anybody encountered the idea of a narrative pedagogy? Okay, does that mean that's part of it? We had a big debate. We're in the process of running our 3-day health science educators introduction course, which is always exciting. It's really nice to meet staff members who are keen to become involved in the idea. But one of the big debates we had yesterday afternoon was, do you physically reward students in your classroom? Like, is it ethically appropriate to give treats or sweets or prizes and things to try and encourage students to participate in class? So it was a resounding debate, because there were a lot of high running feelings on both sides. I'll tell you, my personal opinion is, of course, you shouldn't really be doing that for lots of reasons, but that's not what we're talking about. What I'm trying to get to here is that people feel intimidated. And so even if they do know something about something, or they do want to say something in an environment, particularly like this, where you guys are all hiding behind your photographs, it's not an easy thing to encourage people to open up. So with that preamble, if anybody's got any idea of what narrative pedagogy is, and all of my rambling has given you plenty of time to have looked up on the side using Microsoft Copilot what narrative pedagogy does involve. So I want to know if somebody did that too. No responses, no reactions, or it didn't occur to you to look it up and now you're looking it up fast. Okay, Janelle. There we go. Okay. Is everybody going to give a thumbs up or a clap to Janelle? So the phrase for me over there is, yes, excellent, rather than focusing solely on content delivery. Because when all's said and done, that's how we were taught. We were told what content was important for us to know and what was going to, how to prepare for exams. What kinds of questions could be asked, and this is the content you have to know. I think a bedrock understanding from this point forward is that actually isn't enough. For students in this kind of environment where it's really easy to get information, even managed information, even information in any vernacular language that you want, getting the information isn't enough, and being able to reproduce information isn't enough. I think it's about creating a learning environment where students are understanding that their background and knowledge counts, and also how to fit that into the thinking that they come from and that they bring to a certain environment, and why that content should be useful in other circumstances. So yeah, the idea that narrative pedagogy is something that we can use is something that has not really taken center stage. And I really think that it's something that we could explore in particular. Well, I was going to say large class pedagogies make it difficult, but there are ways, certainly even using AI, that we can encourage people to have those thoughts. So in my musings, let's get to maybe what the implications for our day-to-day things are. I think we need to grow. Everyone comes into this, I think, on a deficit feeling of, I wasn't involved in developing neural networks, and therefore, what do I really know about AI? But very much like driving cars and even operating machinery in a kitchen, like if you don't really have to know how it works to be able to make it work really well for you. And so I think we have to lose that imposter syndrome and just go, I am immersing myself in a learning environment. I am not the expert in the room. It would be fantastic if other people with different expertise could share it. And I'm not saying it's greater expertise. So if you've got people in your environment, or if you've got students in your environment who are really good, then get them to share. It's not get them to do it for you, and it's not take them away from what they're doing. But I think a lot of it is about collaboration and is about acknowledging that we can all learn bits and pieces from everybody. So from making decisions about what's absolutely core in the curriculum, so that will take time, compared to the things that become extraneous when these kinds of tools are available to students, and then modeling the way that we critically engage with questions so that students can learn that way of being rather than just knowing stuff and then keeping that separate from the way they're going to practice. And I think here, so preaching to the converted, because you are all here, that acknowledging that staff learning is absolutely key. And in the coming weeks, what we're going to try and unpack are ideas of what people have done. So I'll give you a shout out for next week. Professor Ashraf Kuvadia is joining us next week to have discussion about the ways he's used AI in developing students' history-taking skills, and also looking at AI as a tool for assessment under those circumstances. Because not only do we have to change, and here we're talking about what we teach in terms of curricula, to make space for the behavioral things, how we teach it in terms of the learning environments that our students are encountering, and also the opportunities that our students have to learn. And then lastly, how we assess it. What kinds of questions are we asking students that show their capacity to interact with the AI and engineer their prompts accurately to get the kind of information that we want to make it useful in their professional lives? So at all three levels, I guess what we're looking at is developing different skills and acknowledging that what we currently do, or what we have been doing up to now, was okay up to now, but now we're in a different playing field. And so it would be useful, even in a small way, to start thinking about what is one thing I can change in the next block, in the next week, in the next assessment, to make the learning about being and becoming rather than passing exams, I guess, as the standard. So if I can wind up, we can say that the being part of who we would like our students to be, according to your right original word cloud, is human. And if that means H+, then we need to, I think, embrace that as well. And the becoming part is the part that we now have in our hands right now. And that is helping students to maintain that curiosity so that when it comes to them being out on their own, they're still becoming. And that's an exciting thing, to think that somebody who's been in practice 20 years and 30 years and 40 years can still feel that there's so much to learn and that they have tools in order to learn it. And then, of course, the disclaimer that AI is here to stay. We should embrace ways that we can use it so that we are helping students to be and become, rather than helping students to skate their way through because the AI has helped them all the way along. So I'm happy to take questions about, especially the material that I've been going through in looking at how it is that we would promote AI use, not only in the faculty, but in strategic thinking on how it is that we can take these kinds of changes forward. But if I had to challenge you to say, what's one way that you could redesign either a teaching engagement or an assessment to better prepare students for the idea of being and becoming in the way we are now, then I'd be really interested to hear what it is you think we could do, and also what resources you think you would need. Because I'm not saying you personally with your 16 hours on your device screen, which really needs changing, but that if you have this really weird and fantastic and off the wall idea, but you don't have resources to do it, what sorts of resources would you think you'd need to be able to incorporate AI into the idea of being and becoming and training our students? And I'm really going to stop talking now because I think that people have been hiding behind this idea, and I'm going to wait to see if people are on board.
Hi, Shirra. It's Stuart here.
Hello, Stuart.
I'm interested. You said that Prof. Cavadia is going to be chatting a bit about history taking next week. One of the things chatting to graduates that they seem to be struggling with is having difficult conversations, like breaking bad news to a family or telling a patient about a mistake that was made or something like that. And I'm wondering the role AI can play in students starting to get comfortable having those kinds of conversations, learning about their own feelings when they've got to deal with something like that. That's not often easy to do if you get a lecture on breaking bad news and then trying to role play it with a group of people around. It often doesn't maybe feel as real as just talking to a person in private. So I'm very interested in the role AI can play in students honing those skills and get comfortable talking about that sort of thing in quite a safe environment. And I don't know if anyone has experience with that.
Thanks, Jude. I mean, I think that's almost tailor-made for the kinds of things that Prof. Cavadia is doing. And I'm really excited that he's coming to share with us, because the whole idea about developing your identity. So who would you like to be? And then showing that identity. So if you're breaking bad news to a patient and you are professional and you hold it all in and you manage, and then afterwards, who do you debrief with? Where do you take it to? How do you come to terms with those kinds of conversations yourself? It's part of a design of the training. So a lecture on breaking of bad news and then a role play doesn't necessarily, as you're saying, equip you personally for that kind of interaction. And I think AI is perfectly placed. But it can't just be that we say, it's like saying, there's the textbook, the information is in there, like go and get it. So I wouldn't say to you, AI is perfectly placed and therefore you must use AI in this. It's about structuring the actual learning experience for the student and deciding at which point they need that kind of support and where they could go for that kind of structure as well. Harin, you're going to join the conversation.
Yeah, thanks. It's responding directly to Stuart's question. So I've used AI for that situation in two situations. One is a lot of the postgraduate exams have these kind of stations, certainly in PEDS. And so in preparing registrars earlier on, I mean, what I would do is I would set up bad news or other difficult patient scenario and basically get AI to generate the whole scenario. In other words, the questions students are likely to ask, the response, what have you. And then I would use that to role play with students. But in fact, from the experience Prof. Cavadia will talk about next week, and I've been part of the team that's marked these, clearly it's much easier now because you can have direct conversations with LLMs like ChatGPT. And depending on the prompts you put on it, it's quite possible to have this very interactive sessions. I think the real skill is doing the prompting. But certainly let Prof. Cavadia give his experience, but based on the history-taking experience, I mean, I marked some of these, and his study was comparing human markers with ChatGPT to even mark these scenarios. That's the crux of that study. But what I'm saying is for these history-taking scenarios, they could be quite realistic and engaging. Over.
Thanks, Harin. Yeah, I think that also with the very fast advent of ways that you can communicate with an AI. So as you say, the talking aspect, it's much more real for a student than having to generate a transcript. And that speaks back to the concept of simulation. So not just simulation with a screen perhaps, but simulation of voices and simulation of scenarios. So I definitely think that there are small things that we could do right now, perhaps that people don't know the capacity of what the AIs that are available to us would do. And that's a space where we could certainly use something different, but well within the capacity of the space and time that we currently have. I'm interested to know if people feel that bringing these ideas in would take more time in their curriculum, or do you think that there are places where you can intercalate this kind of thinking in the current teaching that you do? Yeah, I'm getting the feeling that you're feeling more challenged than, it's like slightly out of our comfort zone. So what I'm hearing from you, or what I'm not hearing from you, is that this is intimidating and that we need to be thinking about ways of helping staff to identify what students are using their AIs for and how we can then intercalate the kinds of training that we're wanting for the Wits health science graduates into part of what it is that we're doing in our current everyday curricula. And I mean, I think it's a great time to sit down and look at those disruptions. So I don't know if any of you read Jonathan Jansen's book after the fees must fall discussion. And he was looking at the idea that students were asking for decolonized curricula. And he was looking for a definition of what they meant in talking about decolonization. And it was really interesting that the suggestions that were coming up for decolonizing a curriculum were suggestions for better pedagogy, suggestions for a more humanistic approach to the teaching that we do, and suggestions that have been made in lots of other spheres that don't necessarily relate to content per se, but the ways that we're designing learning opportunities for students to be engaged with their thinking and their building of their thinking. So it is very much part of the discussion that any disruption eventually, I think, lands back on good pedagogy. And that's where I'm going to leave today's workshop. So thank you, everybody, for coming along. And I look forward to hearing Prof. Kabadia next week giving us another hands-on demonstration, and we'll take it from there. Happy to take discussion and conversations afterwards. Enjoy the rest of your day.
I still haven't gotten into the habit of having Copilot as a tab and typing things into there instead of Google.
Yeah, so do that today.
Yeah, I think it's something I must try. Google gives you that short AI-generated response. It might be quite a fun exercise to do that with students. Get the little generated response and then critically appraise it together to say, can you take this at face value?
Yeah, no, for sure. And then have a look at what Copilot gives you compared to what other AIs would give you, which is, Yeah,
as someone that's still learning about AI, I guess it's a journey I can do with the students.
Yeah. Michael, are you still online? What's wrong with giving prizes?
Yes, I am. I was curious about it.
Yeah. So, I mean, my worry about that is that we're rewarding the wrong things, which means that, yay, you responded in my class, so I'm giving you the pen or the iPad or the chocolate or whatever it is the prize is. And it's not about helping the students develop their curiosity and their confidence and their ability to interact in the ways that we want them to. And it's very much part of that behavioristic idea of, in the classroom, you're either going to get rewarded or punished. Whether it's just my approach to your answer or whether you're going to fail the test, however it goes both ways. And I think we need to shift students away from those responses. So yeah, it was a very vociferous argument. Lots of people didn't agree with me. But yeah, happy to have it at this point.
Okay, thanks for that.
Okay, cheers, everybody. Enjoy the rest of your day.
Bye.